You've expressed optimism about having a vaccine by the end of this year or early next year. What does that mean in practical terms? Do you expect a vaccine to be authorized by the FDA by then? And when would you expect it to be widely used across the country?
The federal government has invested hundreds of millions, if not billions of dollars to make vaccine at risk. At risk doesn't mean at risk for safety, and it doesn't mean at risk for scientific integrity. It means at financial risk, because if the vaccine works, you've saved multiple months. If the vaccine doesn't work, you've lost a lot of money. But the government feels that even if you lose that, it's worth doing it to get a head start on the production. So we likely are going to have maybe tens of millions of doses in the early part of the year. But as we get into 2021, the manufacturers tell us that they will have hundreds of millions and likely 1 billion doses by the end of 2021.
There's concern among the general public that a vaccine's going to get introduced before the risks are fully known.
Right.
How will you know about potential long-term side effects, and how can you reassure the public that the vaccines are going to be safe?
I would want to feel comfortable when I've had enough people in the trial that I get a good efficacy signal and a good safety signal. And that means you've done thousands of people and you don't see any unanticipated, unexpected, severe adverse events. You give a vaccine to someone who's perfectly well that you're trying to prevent infection, which means you're going to be giving it to hundreds of millions of people. So you better be darn sure, A, that it's safe, and B, that it works. And that's the criteria.